Hey, Thrive Tribe, welcome back to Warrior Voices. I am super excited about today's episode because if you are a listener to all these podcasts, you have probably often heard me refer to an organization called Haven that offers resources and services for survivors of domestic violence and sexual assault. And today we have Jeanine, which is a forensic nurse for Haven. So I'm super excited to get Haven on here. So all of you listeners can learn a little bit more about their services and why I love them and support them so much. So Jeanine, thank you so much. Welcome to Warrior Voices podcast.
Thank you, Jamie. It's a pleasure to be here. Thank you so much.
You're welcome. So, like I just said, on this podcast, I talk to a lot of survivors of different types of trauma. Um, but it seems like, we have a lot of domestic violence survivors or sexual assault survivors. So I often plug in Haven because I believe in your services and you guys have been around, 50 years? I feel like
Uh,
30 years. It's a lot.
50, because we celebrate our 50th this year. So yes, so
Yes.
51, yeah.
All right, so 50 years, because I know, I used their services back when I was in ninth grade, which was a long time ago. So, um, anyway, so I'm really glad to have you on here so you can, share a little bit more in depth about the services. How long have you been with Haven?
So I've been with Haven since 2003.
2003. Wow.
2003, actually 2004. I've been with Haven. So
Wow. That's
yeah,
that's
not full
incredible.
time, but as contractual on call. Became full time in March of 2020. So
Okay. No, that's an incredible career, and how fulfilling that must be, that you are out there with boots on the ground doing the work to help survivors. So like I said, you are a forensic nurse. So you are almost like a first responder, if you will. Like sometimes you're the first face someone may see after a strangulation or a rape. Is that correct?
one of the first, yeah, either the first or the second. Yeah,
Okay.
yes.
So let's dive into it. If someone, so you do strangulation exams, forensic exams, and you also do rape kits. So I kind of want to just talk and let the listeners know, you know, how that works, how the process is, how do they start the process? Not, only just maybe a resource for themselves, but if they have a loved one that may go through something like this, that they have this information, which would be incredibly helpful to the person that's gone through it. So, what would be step number one getting Haven services?
So step number one would be giving our call to our crisis line. Majority of our referrals are about half and half from hospital, and then the other half from law enforcement. And then we do get some of our referrals from patients or clients who have been with us before. Um, so usually what happens is we get the call from crisis line for that referral. They reach out to the nurse that's on call, and then the nurse on call will contact that person that made that referral, and then also talk to we call them patients because we're medical. We'll talk to the patient, explain what exam we can do, what that looks like, and then the time, how long an exam can take. Because sometimes my average is about 3 to 4 hours from beginning to end, and then our mandatory reporting guidelines, and then ask them if they want to do an exam. And then if they do, when they want to do it, and so on.
Okay. So, you said it starts 3 to 4 hours. What is all involved in that?
So what we do is when we do make that appointment time, the advocate and the nurse will meet the patient wherever they are. So we can go to any Oakland County hospital if they can't come to us safely, or they can come to one of our clinics. We do have our main one, which is in Pontiac, and then we also have a office type exam room in the basement of Royal Oak Corwell. And then so what we do is we'll go over consents first, and then get their medical history, surgery history, the history of what happened, ask more detail of what happened, and then do that exam. So that exam looks like we'll do a head-to-toe assessment, We'll do a detailed genital exam if they were sexually assaulted. We do a detailed strangulation exam, which usually involves more from the neck up. We look in the mouth, in the ears, and the eyes, on the neck. And then we do collection of forensic evidence. So this is a courtesy to them if they want that collection completed. And what that looks like is a bunch of Q-tips that we swab on the areas that they were touched or assaulted, and to look for DNA other than theirs on their body. And then for sexual assault, we will treat them prophylactically for any STDs, HIV, or pregnancy. And then when the exam's complete, then we'll discharge them. We make sure that they are going, if they are going to a safe place, if they are going back to the environment that brought us to them, that brought us to us in the first place, then we'll make sure that there's some safety planning. And that's usually the advocate will talk to them about that safety planning if they don't feel safe, what that plan looks like.
Wow, that's incredible.
Yeah.
Um, and I've said this before that my daughter was strangled when she was 18. And I ended up going through that process with her. We called Haven's Crisis Line, and you guys were able to see us pretty much immediately. It was like within the hour or two. Um, and so when I took her there, it was just a much different type of environment than as if I would have taken her to the hospital.
Mhm.
And I want people to understand that because, like, when we came to Haven, it was very cozy. It was calm. It was just the forensic nurse and maybe an advocate, I think, that was there that talked to us. And even when my daughter went back for the exam, like you said, it took a couple of hours. An advocate was coming out and checking on me and asking if I needed snacks, if I needed coffee, if, water, anything. And just asked me how I was doing as a mother that, had just went through this tragic incident with my daughter.
Mhm.
And so what would you say to that? Like the difference between getting this kind of an examination from a forensic nurse through Haven versus a doctor, nurse, hospital type environment?
So we are specially trained. We have to be registered nurses, obviously, through the state of Michigan. We are trained to do these specific exams. It's a 40-hour training that we do online currently. And then there's an orientation process. So it's a lot more detailed than just like for females, if you go and get a pelvic exam at a gynecologist. We're looking for more information or more injuries than you would from a doctor just looking, or even a nurse just looking at your genital areas. So we're specifically trained to do that. We have to maintain those continuing education as well. So we're constantly doing evidence-based practice, make sure we're up to par on that. We also are trauma informed. So if anybody's been to a hospital, there's no privacy. I mean, you have a curtain, maybe you may be in a room, but sometimes you can hear the people next door. So we really pride ourselves on having that privacy here at our facility, um, to provide that one-on-one care. Like, we're not taking care of other patients. We're taking care of that one person. And we're not being called, to do other things in like a hospital setting would. And then, like you said, we can provide that support person support as well. Our advocates, our nurses, we're all trauma informed, trained. So we can feel good and feel comfortable having that patient who has been through the most traumatic event in their life, possibly one of the most traumatic events in their life, providing them with that care that they deserve.
Yeah. And I love that. And I think that's just huge for people to understand that is, like you said, I mean, you alone have been working with Haven for 20 plus years. So you are working every day in that type of environment that surrounds supporting survivors. That is what you do. So you know how to communicate with them. You know how to be gentle with them. You understand the environment that they need during a crisis. So you guys are able to provide that. I know when my daughter Hope had her strangulation uh, forensic exam done, that you guys also found 55 notable marks on her body. So I think that just goes to say what you were just saying, that you kind of look all over, from head to toe, not just the neck area.
Mhm.
And with that evidence, if you will, um, my daughter was able to get a PPO against her abuser, and then additionally, she was able to use that to get him put in prison for abusing her. So I think it's just so critical that we get this resource out there, because just the environmental difference. I know going to a hospital, you may sit in the bed for an hour before anyone comes in, and
Mhm.
then they may talk to you a little bit, leave, then somebody else comes in, and you got to repeat your story, and then they do the exam, and then it's cold, and it's probably extremely uncomfortable, for especially for women, that's younger women that may not, this might be their first experience at this. And so having, like my daughter, for example, having just that one-on-one, and she only had to tell her story once, I
Mhm.
know made a huge difference with her. So thank you for that. So
Yeah, and
tell
we've
me.
had, like, patients that have been in the ER for 8 hours, 8 or 9 hours before they even call us, and then they're calling us, and then it's another, 3 to 4 hours, and they're really discouraged at that time, so we tell the local ERs, "Just call us when you hear medically clear them, call us, and then we'll come do it," instead of this person waiting in the waiting room. This person told them what happened, waited in the waiting room for, like, 8 or 9 hours, and then they called us.
Wow,
And
just
yeah,
feeling so vulnerable and so exposed,
right.
sitting there. So, so that's just another important thing to note, everybody, is that if they were to go straight to a hospital, say maybe they were brutally assaulted and had a broken arm, so they went to the hospital, but was also raped or strangled. They can, at that point, as long as they're at an Oakland County hospital, uh, ask for Haven services at that point,
Mhm.
right?
Yep, and we can come in, do the exam because 'cause they're probably not gonna obviously send them home right away, they're gonna fix that broken arm, and then we can come and do that exam, and they don't have to wait any longer until they're discharged, and then we see them, so
Okay. And then tell me a little bit more about, so obviously everything's confidential.
Mhm,
And then I think another thing that's great is if after a forensic exam, if there's a need for any other services like a PPO or a court advocate or counseling, that you guys would refer that at that point, right? Or you
yep,
tell me how do they get other services? Because I think it's really important to point that out, because it's not, again, not having to tell their story over and over again. Um,
mhm.
Working with 5 different agencies to get 5 different types of services. So tell me a little bit about that.
Yeah, so that's why, we're all under one building now. They did this in 2015 to put us all under one, so we're not, separated, like how you talked about. So we have counseling, we have, PPO, we have court advocacy. It says nurses can also go to court and testify as an expert witness, to our exam that we did, so that also helps with prosecution, and helps ease a little bit of anxiety for that patient or client when they have to go to the court system, because that can be intimidating. But yeah, we can offer that. We also have shelter, and we also have a pet shelter. So if they need if they're in immediate danger, we can provide that shelter, as well as bring their pets with them. And there's also children that, and we do men, women, and children, and
Wow.
pets for that shelter. So
Yeah. You guys offer so many incredible services. And I think that that it's very rare to find any type of shelter that takes pets.
mhm,
I think that's just another reason why Haven is unique and fabulous, because they do. And as a survivor myself, I know that a lot of people will stay in an abusive relationship because they don't want to lose their pet, or they're afraid to leave their pet behind with the abuser.
mhm,
Oftentimes abusers will use the pet, threaten the pet, that kind of thing.
mhm.
They'll use them to abuse. So tell me a little bit about that. Like, what did you have seen as far as that being a huge benefit for for survivors?
Yeah, so also when we do our exams, we can also provide them to bring their support animal. A lot of them don't know that they can come in because we have a waiting area, um, that they can bring in that support animal. So I know we have used the power and control wheel that I want to say, I'm trying to look for my statistic on that, but it's like 74% of people who have pets are afraid to leave because of the threat that they have. The abuser has threatened them with that killing or harming the pet. Sorry, 71%. I just found it. 71% of women in DV shelters report their abuser threatened, injured, or killed a pet as a means of control. And nearly half, about 48% of domestic violence survivors delayed leaving because they cannot take their pets with them. So, and we recognize that. Yeah.
Wow. So some really good stuff. So back to the forensic exam. When, is there any, well, I guess I'll just ask you, is there anything else that you want others to know about the process or how they would go about getting one? I know that always starts with the crisis line. I think it's important to note that you guys are available 24/7.
Correct. 24/7, 365. We have coverage all the time. So there should be no reason. Sometimes there may be a couple exams that are back to back. So maybe a little delay with that. But we are 24/7, 365. Also, our sexual assault exams, we only do up to 5 days past a sexual assault event. And then for our strangulation exams, we do up to 30 days after a strangulation event. And we do that because of the delayed death that could occur from a strangulation.
So tell me a little bit, let's go into that a little bit more. Why the 5 days after a sexual assault and why the 30 days after a strangulation assault?
So the sexual assault 5 days is to collect that forensic evidence, to collect that those swabs, um, and then also treatment. So there's certain medications that have to be within the 5 days, actually within 3 to 5 days, um, to prevent any like pregnancy, STD, or HIV. For strangulation, the delayed death could occur from any tear. There's tons of internal structures in the neck that could be affected. One of them is thyroid. There's been studies out there about like 2 to 3 weeks after that could be affected, which could be like high heart rate, high blood pressure. There's also stroke-like symptoms that could occur weeks after a strangulation. So when you have your carotid or like your main arteries in your neck, from a pressure, you could develop a tear, which could also promote or develop into a clot that could go to the brain. So those stroke-like symptoms could occur. So we want to assess those symptoms if they occur, and that's why we can do those up to 30 days. And also, we do follow-up exams for our strangulation. So if we see any injury from the neck up, like we're looking for multiple things: petechiae, bruising, any injury, that we'll bring them back. We usually call them about 2 to 3 weeks after, to bring them back to do that reassessment.
Wow. Wow. Thank you so much for sharing that information because it's really great to know because I think one thing right away with sexual assault, we've all been led to believe that you have to have a rape kit done within 24 hours in order to collect evidence. But like what you're saying is it's not even just that, it's getting you some medications to hopefully prevent any type of STD or anything like that. So even if it's been more than 24 hours, there, it's definitely still helpful to come and get that exam. Um, and then the strangulation, again, that's really great information because to me, if I were to get strangled and didn't die immediately, I think there's nothing, I would have never known that there was lasting um, issues that could come up. I would have never known that. So thank you for sharing that. That's super important. And um, to me, if someone were, I guess, what do you constitute as a strangulation? Let's say somebody grabbed me by the neck, squeezed pretty hard, and was like yelling at me, but not sitting on top of me, really trying to choke me out, trying to kill me, but just maybe held me up against the wall and put pressure. Is that considered strangulation?
Anything placed around the neck that could occlude any of breathing, because it doesn't take much to impede that circulation. It takes less than opening a can of pop to if you put pressure on somebody's neck. It could be a hand. We've had some patients come in who have the assailant use their sweatshirt. They've used a shower curtain. Sometimes cords, not so much. Maybe like a phone charger. But usually, majority of the time, it's the hands. And then sitting on them is even more, could cause more injury while they're putting their hand around their neck.
Wow. And I could be wrong about this. But I think I remember, so like when my daughter was strangled, I know he tore off his tank top and he was strangling her with that. And I believe you guys swabbed for something around her neck, and I thought it had something to do with the shirt. And then I don't know if it ended up matching or something, but I know, is that something that you guys do? Do
We
they
will swab around the neck. So I'm thinking maybe because if somebody touches somebody, their skin cells are their DNA are on their skin cells. So
oh,
if he took off his shirt and put it around her neck, there's possibility his skin cells could be still on that shirt and that was around her neck. So,
yeah.
but as far as like any fibers from the shirt, the crime lab doesn't test that, but they're probably looking for like his DNA from that shirt.
Okay. So I'm glad you clarified that. I just know that that was part of it, was those DNA swabs, which again, I never realized that was a thing. I get it for like sexual assault kits, but not necessarily a strangulation kit. But
hmm
that makes sense that they transferred their DNA, and if it's coming from their hand, that's just more evidence that they had their hands where they didn't belong, right?
Right. Right.
Um, so I want to share something with you. So I run this trauma survivor ambassador program, and I'll just do a shameless plug here that Haven is one of our nonprofit partners through this trauma survivor ambassador program. So when like this is one of our shirts, it says trauma survivor, which you can actually get this customize. It could say, cancer survivor. It could say DV survivor. You can actually customize that. And on the back, it has all different kinds of sayings. You get to choose one. Right now, I'm wearing one that says, "My trauma does not define me." But every time someone purchases either an article of clothing or swag, Haven is listed as one of the nonprofit partners, and you guys automatically get 10% of every sale. So, in that 10% goes to things like this, like the sexual assault and the forensic nursing services that they can get, along with shelter and all the other services. But one of my ambassadors, so I have several ambassadors that really their responsibility that they take on is to just talk about trauma. They've shared their story either on the podcast or through their social media, and they're just trying to open that communication for other trauma survivors so they don't have to suffer in silence. And we had a lady reach out that had her significant other had done that exactly. He had grabbed her by the throat, and was kind of holding her up by her throat. So her feet were off the floor. And um, and she had pictures of it that had marks, red marks and things like that. And she had reached out wondering like what she could do. And our job as ambassadors are not necessarily to give them services. Our job is to refer them to services such as Haven. And so that's what we did is we referred them to Haven and was able to give them the crisis line and just talk about the different services that you guys offer. And when she was told, like, hey, that they do these strangulation forensic exams, her response to that was, I didn't even realize that that was strangulation. So do you hear that often? Because to me, that's a classic minimization of trauma, which sometimes we will do as a survival technique. Like it's not that bad. because we have to live with it on a day to day, or we've lived with it for so long that it becomes normal. So tell me a little bit about how that might show up in survivors.
Yes, so we do get that. Some will come in and say, "Well, he didn't squeeze that hard. He just did a little, um, not even a squeeze. I can't remember the word she used, but just a little this." And we educate them and tell them that it doesn't take much to cause injury. And we tell them about the different structures and what could be sometimes could happen after a strangulation. We've had them say, well, it wasn't that hard this time. He didn't squeeze that hard this time. He used his hand this time and not, my shirt. And sometimes we have people that come in and say, um, this was the worst it's ever been. And sometimes that's when we do see them is because it's the worst they've ever had. Like maybe they lost consciousness, they passed out. Maybe they've involuntarily urinated on themselves or involuntarily had a bowel movement. They woke up in a different spot. And so a lot of times we'll see them at that time. And it takes like survivors, clients, patients about 7 times before they finally leave. And that's probably the hardest part of this job is discharging back into that environment, but they have to do what's safe for them,
Mhm.
and we recognize that, and it's difficult, but we just have to support them and let them know that we are here to support them for that decision that they make. So, but yeah, we hear it from both ends. It wasn't hard. It wasn't this bad this time, and it was the worst I've ever had. So,
Wow. And again, I just, well, under like what you're saying, it is on average that it takes 7 times, up to 7 times, for a survivor to leave a situation permanently. But I
yeah,
also want to note that leaving a domestic violence situation um, can and usually will escalate. So you guys also offer a service called a safety plan, right? Is
mhm,
that how we call it, safety plan?
yeah.
So if I always just like to throw this out there that if anyone is in a domestic violence situation, relationship, that if you plan on leaving or looking to get out, please don't go about it blindly. Please reach out to a service such as Haven and um, and ask about the safety plan. So I don't know if do you do safety plans or does somebody else do
Usually
those?
it's advocates, will kinda help. The advocates may talk to them about safety plan, while we're in there giving discharge. Usually, because like you were saying that it increases when they leave, they're at 750% increase to die by the hands of their abuser if they leave. This is the training that we've had, and it's so heartbreaking, um, that it takes them, that it happens like that. It's just terrible. But yes, we do um, sometimes I've been in conversations with the advocates when they've done safety planning, like, do you have somewhere safe to go if you don't become safe? I think they talk about putting a bag together with like important documents, um, maybe a stash of money, stuff like that. So I've heard bits and pieces.
Yeah, and I have too. I've just heard bits and pieces, and that's why. Like, if anyone was asking, like, come to me or any of my ambassadors, we don't do a safety plan with them. We will refer them to someone that offers a safety plan. I did notice, like, one of my ambassadors sent to me. I don't remember offhand. I think it was like the National Domestic Violence website. They have um, an example of a safety plan on there that someone could go and print out just to kind of get an idea of what that might look like. But even with that, I would walk with a professional through that and,
Yeah.
from Haven to really feel safe. But yes, gosh, nowadays, and I hate to say this, but it has become so prevalent lately, even in Oakland County, about these domestic violence situations ending up in a murder suicide. And I think suicide has become so prevalent that that has something to do with it. It's like, well, I'm just going to, if the abuser is suicidal, that really could put your life in danger because they have nothing to lose if they plan on committing suicide. They commit murder and then suicide. And so I think now just the escalation has climbed to a whole new level. And I don't know if that's just been like after COVID that, I don't, cause I don't remember these ending in either murder or murder suicide as much as I hear about it now.
We see a lot of patients will come in and they'll say that that is their because we ask them about suicide if they're feeling suicidal. But they'll say, no, but this person that is abusing me is threatening suicide if I leave them. So that's a lot of times why they won't leave because they'll feel guilty, if something does happen. But our strangulations, from what I've seen since I started here, they're becoming more violent. They're not just strangulation. They're um, hitting, biting, pulling hair, punching, use of weapons, sometimes use of threat with a gun. We've seen it increase in like our injury, especially with sexual assault as well. It seems to be becoming more violent. So from what we've seen,
Wow.
yeah,
So thank God for services like Haven, and all of this knowledge that you so kindly have taken time out of your day to sit with me and share, because I just think this is so important. And what do you say to survivors, men or women, that are in abusive situations that might be minimizing their abuse or their trauma? I often say that's a survival technique, is able to do that. But like if they say, well, I don't have black eyes, or, he just pushes and shoves me or locks me in a closet, when he's really upset. It's really not that big of a deal. What should we be saying to them when they're saying this, to get them to see how abusive it really is?
yeah. As far as like the public, I know with us, we tell them that this becomes more frequent because we do ask that question. It's become more frequent. Are they becoming more jealous, more controlling of your daily activities? And we tell them about that it could take 7 times, and don't beat yourself up over it because you haven't left this time. You have to do what's best for you and your safety, especially if children are involved as well as pets. Um, so we'll try to educate them on, what could happen if this continues. You could potentially have a stroke, especially with strangulation early, like within the early ages, like 40. And we try to educate the ER staff as well. Like if you get a young person in with stroke-like symptoms, maybe think about asking if they have ever been strangled, um, or choked, another word that the public uses. And we'll tell them, we're here to support you. We can't tell you what to do, but we're here to support you. And I'm a safe person. So if you need to, if you're in the public, just be that safe person for them and listen. Try not to give them advice because sometimes they don't want to listen. They don't want you to tell them, "You need to leave, you need to do this, you need to do that." They have to do what's right for them, so
Well, the idea is, and I cannot stress this enough, but when someone comes to you, they are looking for support. They are not looking for you to fix it, or do they know how to fix it themselves, right? And I always say, you don't have, I'm an empowerment coach, and I'll say, I don't have the answers. I need you to tell me how I can best support you or bring out the answers for themselves, because what might work for me doesn't mean it's going to work for everybody. So letting people know what you would do in the situation doesn't necessarily give them real good, solid support. So, speaking of support systems and the fact that it could take several attempts to get someone out of an abusive situation. But this also goes for like anyone that's maybe in addiction. It For support people, it is like, even in your position, it's very difficult to be in a position watching somebody be in this situation and not getting out of it. Right? You feel helpless. You feel like you're not doing enough. What else can you do? And you can go crazy. I know with alcoholics and things like that, they have like Al-Anon, they have support groups for that. But what do we tell, like for me with my daughter, she was in one abusive relationship after another because she had mental health issues. She had very low self esteem, she had no self worth, and it became her normal. Abuse to her was normal. And it scared the shit out of me every single day. And she would just go back, and I would just be so frustrated and feel so helpless and just like, oh my gosh, I'm going to get that call one of these days. Right. And then I did. So, what can we tell loved ones and supporters how to hang in there and what they can do um, to help them feel, I guess, not so useless because they're not. They're not.
Yeah, that's a tough one. Because we get a lot of that parents for adolescent and adults, how can I best support? And I'm just like, just listen. Just listen, be there for them, don't judge. Don't victim blame them. They have to do what's best for them, and their safety. And then know your resources. When they finally are ready to leave, um, or get out of the relationship, have that resource ready for them. So
Yeah, I love that. And that's, another thing that I'm working on right now through the program is trying to get a resource directory together for all types of traumas that they can search domestic violence and all of those resources will show up. Or if someone's diagnosed with cancer, then all of those will come up. And I did it more so for the loved ones, the parents, because you feel so helpless and
yeah.
you can't force them to leave, but by God, you can have all of these resources ready. So when they're ready, you have it good to go because they're to try to find help when somebody is coming out of domestic violence or, maybe even in an addiction, which I can speak to because I'm a recovering alcoholic. Um, you get overwhelmed very easily. We're typically very, very depressed. And when we call and they don't have services, it's a rejection. It's almost like a form of rejection. So you can get defeated really, really quickly. So often we'll lean on loved ones or supporters to help us find those resources. And not to mention, there's a small window of time that we're like, okay, we're ready for help. And loved ones need to jump on that before that window of time closes because often then fear sits back in and it's like, you know what, this is too hard. I'd rather just stay, you know, and then they change their mind. So I think what you said is just key is having resources
Hmm.
and just, even if you got online and took a pad of paper and a pen and just wrote some down, that you are actually helping them. Maybe not at that point, but you're going to feel a little bit less helpless by doing that, by being prepared, by even like packing a bag, doing something. You know what I mean? You can still do something to be prepared for when they are ready.
Yeah. And when we present to like law enforcement, hospitals, to school nursing, the health department, we just tell them, just plant that seed. If we know they're not ready to leave that time, just plant that seed. Let them know that we're here. And then,
Tell us
um,
what plant that seed means, because a lot of people might not understand that term. What does that mean?
so just letting them know that there are services out there that can help them. You can say, you can say all day long, you need to do this, you need to do that, but just let them know that that you're a support, that you're there for them, you're being non-judgmental, that there's services out there like Haven, and they know that, and they can have that in the back of their mind. So when they are ready to leave, they can reach out.
Okay, good stuff. I just want to ask you one or two more things about some of the common things that might come up that a survivor may resist any sort of help. And one is like shame or guilt. And I think the feeling of shame or guilt, or maybe they're part of the problem, quote unquote, keeps them from getting help. So, how does Haven navigate through those feelings with survivors?
I know when I can speak for myself when I do exams, I'll tell them that because they blame themselves. And they feel guilty. And I always tell them it's not, this is a decision they made to do this to you. This is not something that you um, wanted or asked for. This is their brain is, I always tell them their brain is the sick brain. It's not you. Their brain is the one that decided to do this. Their brain, they have choices. So you didn't choose to have this done to you. So that's one way that, from the nursing perspective, that we tell them about. So,
Hmm. Again, another beautiful reason why to have Haven do these forensic exams, because I just don't think that the doctors and nurses at hospitals, I mean, they do amazing things and they save lives every day. I'm not trying to discount them. But you guys have this specific training for all of this stuff that survivors go through. And that's, you know, helping them with the shame and the guilt and non judging. And, after my daughter passed, but because she had addiction to drugs and alcohol, um, she truly was treated like she was worthless, even after she passed, by some first responders, let's just say. And drugs and alcohol to me are often a mask for trauma. It is a coping skill, it is not who they are. And I think it's so shameful that people are treated poorly because they may show up, um, with a history of use of alcohol or drugs. And I really want to do work around that and getting first responders and police officers and doctors and all the people that, I get that they have to build an armor, and I'm sure you do too, for being in the work line that you guys are in. It is absolutely, there is a such thing as called as secondhand trauma, right?
mhm.
When you are, and I get it as well because I work with trauma survivors. I hear all the stories. Um, so you almost have to build this kind of armor to be able to continue showing up for your job every day, but not so thick that we forget that they're human beings underneath that. And like you
Mhm.
said multiple times today, that um, you don't judge, right? Uh, how important is that to show up and to offer a judgment-free zone for survivors?
It's very, very important. I mean, so my history is ER. Unfortunately, well, after I started working in this field, recognized how bad I was at being very judgmental in the ER. So I know how the ER staff works, nursing, techs, doctors, even EMS, fire. And it's very important because it offers them a, how do I want to word this? We do non-judgmental and empowerment basis. So that's our biggest thing, is empowerment too. So we're offering that control back that they lost, in a non-judgmental way. We're not going to judge them because they're not going to do a certain part of the exam. That's up to them if they want to do that part or not. But it helps with them participating, getting that care that they need, decreasing the suicidal rate after a sexual assault or strangulation, helping with prosecution, providing that non-judgmental is participating in, from beginning to end, that portion of what they need to heal from a traumatic event.
Yeah. And you guys see survivors from all walks of life, right?
Mhm.
Um, they could be rich, they could be poor, they could be sober, they could be addicted. I mean, you've seen it all. You've seen all the different stories, and I think again goes back to why your service is so unique. When someone comes to you guys for these services, is that you're not just trained in it. That's everything is embodied into all of this, right? And so you guys can offer a much more, um, I don't empowering experience than at a hospital or anything like that. And again, in the hospitals don't offer follow up work, PPOs, advocates, safety planning. Um, so I guess let's kind of wrap this up in, first of all of these services are free, right? So if anyone needs to come for a forensic exam, they're not charged, correct? Okay.
Yeah, all treatment services are free. Counseling, the therapy, the groups, advocacy, our exams, our medications. The only medication that we would need insurance for is that HIV prophylaxis medication, but we offer starter packs. So we offer like the first 3 days at no cost. So yes, all our services are free. We don't want that to be a barrier. And we can provide transportation if transportation is a barrier as well.
Wow.
Yeah.
Wow.
And that is free as well.
It's amazing. So, but somebody's got to pay for these services, right? Somebody's got to do something. So, how can we support Haven? How do you guys? I imagine you guys get grants, things like that. But um, with everything that you guys offer, I know you can't put all your eggs in one basket. And we do a lot of work. Well, with our Jeep Babies group, we do events. A really big event for Haven to raise money every year. So, what are some ways that everyday people like us can help support Haven so they can continue on giving these just incredible services?
Yeah, so we do get a lot of our, we get federal grants, state grants, county grants, and then we are also have our private donors. But yes, volunteering is huge. We rely a great deal on our volunteers. Um, to help us with multiple events like our gala. We have our gift giveaway going on right now. We do trunk or treat. We just do a lot of stuff. So volunteer definitely would help. I know a lot of nursing students will do a fundraiser for medical supplies. I know our one hospital system will make blankets that we can give to our patients, especially our pediatric and adolescent patients that really like the blankets that they make, in our shelter too. Um, Donations. We're always looking for donations for I think we have, our Amazon wish list right now is, geared towards a gift giveaway, but starting in January, our general wish list will be out there too. So, um,
So,
I
lots
think
of
that
ways. Lots of
yeah,
different ways. Volunteering is big, and they can
yeah,
find all of this on your guys' website, which I will put along the bottom here, and I'll also put in the description how they can sign up to be a volunteer or to donate. I think it's really important that, like, if you're in a car club, if you are in a sewing club, if you are in a book club, that even if it's a small group of people, can make a huge lasting impact. And
mhm,
I would highly, highly recommend any type of group out there. Maybe you even get some coworkers together and do some sort of event. And like you said, even for like medical supplies. And what the Jeep Babes have done, even with like your Amazon list, is I will contact Haven and say, what are your like top needs right now? And then I'll make my own Amazon list, right? And I get all of the Amazon stuff sent to my house. Boy, my husband loves that. We're filling the garage full of this stuff. And then we make it fun where, our members go with us to drop all of the stuff off at Haven. So I would really encourage anyone to reach out to Haven if you have a group and you want to do some kind of fundraiser. They can be fun. It doesn't have to be a massive um, undertaking, but it could definitely bring, like you said, blanket making. You want to do something great with your cousins or nieces and nephews, is spend an afternoon making blankets and dropping them off to Haven. I do want to make an important point that because of your guys' funding, donations have to be, like when it comes to clothing, that kind of stuff, they have to be new, correct? They cannot
correct,
be used. So I just want to
right.
make sure that we added that so people are not showing up with a bunch of stuff that you can't use, and that's only because of the funding. It's not personal preference. But so, anything else that you want to share with the Thrive Tribe about Haven, or specifically about forensic exams?
I don't think so. No.
Okay, so well, again, I appreciate you being here and explaining, because every time I talk with you, Jeanine, I learn something new about Haven. I learned something new about the services that you guys offer. And my ambassadors and I are often, contacted by people looking for services. So I appreciate that we have Haven in our back pocket, that we can often, refer. But speaking of their gala, I do, and I'll put the information in the description as well. I believe your gala for 2026 is going to be May 1st.
Mhm.
And this is a once a year amazing dinner that they put on. They usually are spotlighting a survivor story. They're giving out volunteer or partnership um, awards. It's just an incredible, very empowering night to be a part of. It's always at a beautiful venue with lots of great food. So follow Haven on their Facebook page, everybody, and or on Instagram. They're on LinkedIn to stay in touch with all of the things that they have coming up. And I hope that I will see some of you guys out there at the gala. It's a great night to be a part of. I'm typically a Jeep girl, um, but it's the one night I get to exchange my muddy jeeping boots, trail boots out for some high heels. So I always look forward to that every year. But again, thank you, Jeanine. I am hoping that Haven has a bunch of different like leadership that kind of heads up the different departments of counseling, advocacy, that in the future that I can have them on the podcast so we can learn more specific about those services and how they get, survivors can get those kind of services. But for the Thrive Tribe, thank you again for tuning in. Please subscribe, like, comment. Please share this with anyone that you might know, for even the loved ones that are out there that might have somebody that is currently in a domestic violence situation, and you're feeling helpless. You are not alone. You can even reach out to me or any of my ambassadors um, and get some resources under your belt. So that way you're ready and when they're ready. But other than that, have a great day, everybody, and we'll see you on the next episode of Warrior Voices. Thank you.
Thanks. Thanks, Jamie.
You're welcome. Bye bye.
Bye.